I think all of us know that we have a plastic-filled, metal-ridden, chemical water-laden society, and it's time for us to do something about it. I'm Dr. Murray with Murray Natural Integrated Health, and if you are interested in taking care of your health conservatively, you might want to follow us. If you're interested in your health and actually taking care of your toxic burden, you should be following us as well. Like and subscribe to our page. Got a lot of good information on there, and we have our live streams every Thursday at 7 p.m. So let's talk a little bit about statistics here and about how much of a toxic environment we have today. We know that there are over 2 million poison exposures in the United States every single year, and that the Journal of American Medical Association, they acknowledge that there's over 100,000 prescription deaths each year. And we know that there's also medications that are found in our water supply. Lots of different studies out there, local studies, showing even our local area here in Hastings, Nebraska, in the local Midwest area here, that there are around 100 pounds of mercury emitted in the atmosphere every year because of coal burning from a local factory, a local coal plant. We have microplastics actually are found in the brain, and that's another next week on our next live stream. We're going to talk specifically about microplastics and also chemicals in our environment. So make sure you come and listen to our live stream at that time. And we know also that in New York City, about 1 in 4 adults there have high levels of mercury. It's so high in New York that pregnant women are advised to only eat 1 serving of fish a week because of the mercury content. And again, also if you look at the foods that we're consuming, when you look at the non-foods we're consuming, such as cola, we know that those are related to the regular as well as unsweetened colas are related to stroke as well as to weaker bone density. And the interesting thing is, if you look at the studies here, that we know that heavy metals are related to abnormal hormone levels and also infertility and also cognitive dysfunction. The question is this: why isn't anybody testing for these things? We can test for it. The Cleveland Clinic, they acknowledge that there's 4 basic ways to test for heavy metal toxicities. Of course, you can do that in the blood. So if you are being exposed to something acutely, like for instance, you got exposed to mercury, a mercury thermometer, the old thermometers, and somehow you ingested that, they would check your blood levels. That would be a good place to check. But the Cleveland Clinic also acknowledges, and so does everywhere else, that you can also test for exposures in the hair as well as the urine and also in the fingernails. Hair is about a 3-month exposure window, so you can see what's kind of been going on from that standpoint, from a 3-month period of time. Urine also, you can see kind of subacutely what's been coming out over a period of time as well. Both good avenues to test. But why isn't anybody testing for these? I mean, it's a great question. And even from a smoking standpoint, here's a slide of a smoker, this individual. That's obviously an area of exposure that a lot of Americans get. But you'll notice here, this individual had high levels of hemoglobin and hematocrit, as well as his red blood cell count were high. We know that if you smoke or have compromised lungs, you may also start to produce a high amount of erythropoietin and also then start to create more red blood cells because you have to transport oxygen more effectively. Well, when we actually did a carbon monoxide test on this individual, we find that his carbon monoxide levels are elevated. Yes, if you're smoking more than half a pack of cigarettes a day, more than likely, you probably have some degree of carbon monoxide poisoning. Now, I bring the slide up just to show is that, of course, you can have carbon monoxide poisoning, but you can also have, from whatever source of exposure you're getting, you're bringing in particulate matter, you're bringing in toxic substances in your lungs, in your body, and in the case of coal burning, which is one source where we get a lot of our electricity from, and mercury being emitted in the atmosphere a year, that's where some mercury and arsenic exposures are coming from. But in this case here, we're talking about smoke itself, where arsenic levels can be elevated as well. And so we have a hair test right here, and this test is regarding this individual, a smoker. And you can see that the arsenic levels are quite excessively high in this individual. So yes, you can test for it. You can test for it in the smoker, also in anybody else who has some exposure issues. You know, four kind of basic areas of kind of toxic exposures. And of course, we get that from the environment. We've already talked about that. Coal burning is one of the primary sources of mercury exposure in our country here today. And another very, very common source of mercury exposure, and no level of mercury is good for you. Another area of mercury exposure is silver amalgam fillings. So there's silver fillings in your mouth. They have mercury in them. And so that's also an area of exposure. And you can test for those things in the hair and in the urine as well. Here's another study just showing here in our local energy plants, showing that, again, the 100 pounds of mercury being emitted in the atmosphere a year. We know that because of certain farming practices that we do tend to have high levels of chemicals in our water that are what they call endocrine disruptors. All this to say, when we talk about water, is a good thing for us to start doing some filtration and perhaps some testing. We're going to show you a couple testing options here in just a moment. But in the water, we know that these chemicals can have endocrine disrupting effects. In other words, they can come in, they look like hormones. The chemicals that are used and that are actually coming into our water supply can affect our estrogen levels or progesterone levels, testosterone levels, and that can affect, of course, infertility, but also weight loss and a lot of those things. That toxic burden that we're taking in on a regular basis is affecting sperm level counts. It's affecting, of course, just the infertility and also increasing the risk of cancer. Multiple studies show this. Nitrates in the water. Another study, another well-known toxic burden that many, at least in the Midwest, when you have farming communities using nitrates, that also is concerning. Well, you can test for that. You can test for that in your house through some simple testing. Now, an interesting point to make is that in the Midwest, and I'm talking anywhere around the Ogallala Aquifer, which can go all the way down into Texas, it's a very large, expansive area where nitrate farming practices are utilized. You can actually, that helps to liberate naturally occurring uranium from the ground. So when we do hair-related testing here, and hair testing, by the way, the U.S. military has used hair testing for uranium. The CDC has used hair testing for arsenic exposure in the past. So you can use hair testing to look and see what kind of long-term exposure that you've had to certain heavy metals, as you can with drugs. So in our office, we do also some drug testing for different employers and law offices and things. And the same thing there. It's around a 3-month window that you can test for it. So with nitrate-related fertilizer and farming practices, that helps to liberate some of the uranium from the ground. And so then you can have, of course, and this is a water-related test, you can have high levels of uranium found in the water, which is pretty common in the area where you have the Ogallala Aquifer, a very large area. There are different areas of the country that have their different areas of exposure. If you're around a mining community, or perhaps you're around an area that creates a lot of metal industry, steel industry, maybe you've got a lot of automotive industry. There's lots of different reasons for having exposures in your area. You can, of course, just looking at nitrates and certain types of toxic substances, you can do some at-home testing, simple litmus test testing, simple, easy one to do. We've done this type of testing in our house, pre and post filter, very cheap, very inexpensive, lots of different options out there. But if you're talking about heavy metals that are present, such as uranium and others, you're probably going to want to have some kind of company that's going to come in and do some analysis, and that specialized labs, there's lots of specialized labs out there, and this is just one of them. But again, you can also test to see how that is affecting, or at least coming into your body, and how you're excreting it. So yes, you can do hair testing. We also do urine testing. So this particular test here, this individual, we did a pre-test on them. And you can see there's only one that's really elevated uranium up into any kind of a slightly abnormal range. But when we use an actual provocative challenge, an actual chelator that helps to bind to different heavy metals and helps them to be excreted out more readily. So what do you do about these things? Well, obviously, you can do a couple things. You should be filtering your water. It's a good idea to do that. If you're not doing at least some kind of carbon filtration, you probably should be. Now, there's lots of different types of substances that aren't going to be filtered out through a carbon filter. So reverse osmosis and distilled obviously are better options from a clean water type standpoint. You need to limit some of your artificial and more toxic type foods. I mean, if it's not a food, you shouldn't be consuming it. Soda is not a food. Doritos is not a food. You read the labels on the back, and there's just a whole lot of things in there that just are not food items. That's why your artificial food dyes and colorings, some of your lake dyes that are in those aren't food. Some of those are made from petroleum products, trying to reduce that. Obviously, smoking, we all know that that's a bad thing for us, and we've tested that. We see that, but you can test. Why is nobody testing for these things? Especially if you have oddball, weird type symptoms, and they've tried multiple different things, and they're saying, you know what, you're just getting older. Well, why on earth aren't people testing for this? It's ridiculous. You can test, you can see. Not to test is to guess, and to test is to know. Getting to the root cause of problems and giving your body what it needs and taking away what it doesn't need is an important thing for us, for ourselves, for our own health, and our family's health as well. Like and subscribe to our page. Make sure you also come to our YouTube page and follow us, and also check out our live streams Thursday at 7 p.m. Murray Natural Integrated Health, setting the standard in natural healthcare. Have a blessed day.